Welcome to Health Educator. Don't forget always to click on the subscribe button. Today's topic: bradycardia and tachycardia. But before we begin, let's summarize heart electrical system. To understand the causes of heart rate or rhythm problems such as tachycardia, you have to understand how the heart's electrical system works. Your heart is made up of 4 chambers, 2 upper chambers which is the atria and 2 lower chambers which is the ventricles. Your heartbeat is normally controlled by a natural pacemaker called the sinus node, which is located in the right atrium. The sinus node produces electrical impulses that normally start each heartbeat. From the sinus node, electrical impulses travel across the atria, causing the atrial muscles to contract and pump blood into the lower chambers of the heart, ventricles. The electrical impulses then arrive at a cluster of cells called the atrioventricular (AV) node, usually the only pathway for signals to travel from the atria to the ventricles. What is bradycardia? Bradycardia is a heart rate that is too slow. A resting heart rate is within the range of 60 to 100 beats per minute. But when the heart rate is fewer than 60 beats per minute, it is called bradycardia. But there are exceptions. During sleep, a slow heartbeat with rates around 40 to 50 beats per minute is common, and is considered normal. Bradycardia is often common in adult. There are 2 basic types of bradycardia. 1. Sinus syndrome occurs when the sinus node, the heart's own pacemaker, fails and does not reliably trigger heartbeats. This is very common in elderly persons, but may occur at any age. 2. Heart block is a complete or partial interruption of the electrical impulses on their way to the ventricles and results in a slow, unreliable heartbeat. Heart block may be present at birth, may result from other types of heart disease, after a heart attack for example, or may be due to age-related wear and tear on the heart's electrical system. Causes of bradycardia. The chances of getting bradycardia increase as you get older, though that's true of most heart conditions. Smoking, drug abuse, and high blood pressure also make it more likely. The causes of bradycardia can vary greatly from one person to the next. The abnormal rhythm can show up after a heart attack or as a side effect of heart surgery. Other things that can lead to it: certain medications, such as those to treat high blood pressure and other arrhythmias, or abnormal heartbeats. A congenital defect, or problem you're born with. Thyroid disease, an imbalance of hormones in the body. Obstructive sleep apnea, when your breathing pauses many times throughout the night. Symptoms of bradycardia include fatigue, dizziness, confusion, fainting, shortness of breath, difficulty when exercising, cardiac arrest. If bradycardia is left untreated, it can cause heart failure, fainting or syncope, chest pain or angina pectoris, hypertension, hypotension, stroke, hypothyroidism. Treatment. If your doctor decides that you have bradycardia, the treatment plan will be based on the likely cause of the problem. What is tachycardia? Tachycardia is a heart rate that beats over 100 times per minute. Sometimes, it's normal for you to have a fast heartbeat. For instance, it's normal for your heart rate to rise during exercise or as a response to stress, trauma or illness. But in tachycardia, the heart beats faster than normal due to conditions unrelated to normal physiological stress. In some cases, tachycardia may cause no symptoms or complications. But if left untreated, tachycardia can disrupt normal heart function and lead to serious complications, including heart failure, stroke, sudden cardiac arrest or death. There are many different types of tachycardia. They're grouped according to the part of the heart responsible for the fast heart rate and cause of the abnormally fast heartbeat. 1. Atrial fibrillation. Atrial fibrillation is a rapid heart rate caused by chaotic, irregular electrical impulses in the upper chambers of the heart, atria. These signals result in rapid, uncoordinated, weak contractions of the atria. 2. Atrial flutter. In atrial flutter, the heart's atria beat very fast but at a regular rate. The fast rate results in weak contractions of the atria. Atrial flutter is caused by irregular circuitry within the atria. 3. Superventricular tachycardia, SVT. Superventricular tachycardia is an abnormally fast heartbeat that starts somewhere above the lower chambers of the heart, ventricles. It's caused by abnormal circuitry in the heart that is usually present at birth and creates a loop of overlapping signals. 4. Ventricular tachycardia is a rapid heart rate that starts with abnormal electrical signals in the lower chambers of the heart, ventricles. The rapid heart rate doesn't allow the ventricles to fill and contract efficiently to pump enough blood to the body. 5. Ventricular fibrillation. Ventricular fibrillation occurs when rapid, chaotic electrical impulses cause the lower heart chambers, ventricles, to quiver instead of pumping necessary blood to the body. This can be deadly if the heart isn't restored to a normal rhythm within minutes with an electric shock to the heart, defibrillation. Symptoms of tachycardia are similar with that of bradycardia. Though some people with tachycardia have no symptoms, and the condition is only discovered during a physical examination or with a heart monitoring test called an electrocardiogram. Causes are also similar to that of bradycardia and may also include exercise, fever, medical side effects, sudden stress such as fright. Risk factor of tachycardia: anemia, diabetes, heart disease, heavy alcohol use, heavy caffeine use, high blood pressure, overactive or underactive thyroid, psychological stress or anxiety, sleep apnea, smoking, use of stimulant drugs. Prevention of these risk factors include: exercise and eat a healthy diet, maintain a healthy weight, keep blood pressure and cholesterol levels under control, stop smoking, drink in moderation, don't use recreational drugs, use over-the-counter medications with caution, limit caffeine, control stress, go to scheduled checkups. If you have any question, leave a comment. Thank you for watching this video. Don't forget to click on the subscribe button to get more video from Health Educator.